Welcome back to Southern California CEO. We've been speaking with Ja Marr Brown, Director of Sales and Consulting Services for ACES and President of the Kaizen Way. Now, as promised, joining us right now in studio is someone who's put Ja Marr's services to the test. Mr. Alex Lopez is the Chief Operating Officer of Atlantis Eyecare and a Kaizen Way client. He's agreed to share some of his experiences in working with Ja Marr to bring positive changes to his organization. Alex Lopez, welcome to SoCal CEO.
Glad to be here. Thanks for the invitation.
You're welcome. Tell us a little about your organization, first of all, and then some of the challenges that led you to reach out to Ja Marr in the Kaizen Way.
We're an eye care company. We're managed and owned by a group of eye surgeons. We also provide optometric services to the community, essentially provide eye services to everybody in Orange County and LA. And one of the challenges that we had is because we do have multiple surgeons and strong leaders in the organization, was trying to figure out who we are as an organization, define who that is, and try to make decisions every day, daily, and move in the right direction for the organization. For example, we were in meetings and a whole hour would go by discussing a decision, and we couldn't make a decision because everybody had a different idea of how to execute the idea, which direction to take the organization. It became very frustrating. We have a very talented group, hardworking group, but we just needed more guidance and defined roles for the organization in our communities that we serve. And that was our challenge.
What was it about Ja Marr and his Kaizen Way philosophy that made you want to work with him?
In our evaluation, we considered 4 or 5 reputable different consulting groups, some specific to our eye care space, some not. The reason why we chose Ja Marr Brown is because we felt that given his experience, his approach, and his philosophy was going to help us really think outside the box. It's going to challenge us not just as a group, but individually. And that was very exciting for us to go through when we actually brought Ja Marr on, and we have great results because of that.
And I'm sorry, Jeff, and I think it's important to mention when you say think outside the box, is one of the first things that we worked on, which I tried to share with the organization, was the leaders and the strong leaders, the physicians and the managers in the organization had such influence over the entire organization. And typically in the healthcare space, physicians are trained to do what? To do surgery and to treat patients. Not necessarily with business skills and understanding the importance of communication, the importance of building a culture in the organization. It's not a knock against physicians, it's just I was trained in business, not in eye care, so I couldn't operate on someone. And the opposite is true for physicians. So I think thinking outside the box was, hey, look, we play an integral role in the effectiveness of our organization, and it starts with us as a team. And that was something that I think once the organization grasped, and we spent a lot of time with the management team first, working with the team to say, okay, are we on the same page? Do we buy into this program? Can we go out and with the bullhorn and say, this is what we're doing, and really believe in it? And that was the first step in the process that I think really made it work.
Let's talk about now, Alex, some of the key areas that Ja Marr was able to help you with.
Well, specifically walking away as a result of the program, we had a defined mission, vision, and values. We had a purpose. So all of a sudden, everybody in the organization came to work with a purpose. I'm here because we're trying to provide value to our community and to our patients. We defined why we're different versus all the other ophthalmology and optometry groups in the community. That was the biggest change. It changed our whole culture. Our organization's discussions changed from just the mundane stuff, trying to argue about who has a better idea, to what is the best thing for the patient and how do we fulfill our purpose the best. Our decision-making process was shortened. We were able to make decisions a lot faster and see the impact, not just for ourselves, but more importantly for our patients and the communities that we serve. And that was a major difference.
Now let's talk about some of the results that you actually saw, some of the real measurable results that you were able to witness.
So one of the things that we defined as a group that was very important to us through the process was patient satisfaction and the patient experience. Now before Ja Marr, I have to let you know that we talked about it a lot, right? But there was not a lot of action, right? There wasn't a lot of, I don't know how to say it, but really oomph and really focus and meat behind what we were saying, and a lot of action really. And after the process, because Ja Marr walked us through it, we were able to put down in paper what that means from everybody. We actually took action and made a difference in the patient experience and the patient satisfaction. So we actually objectively measure those patient satisfaction scores with our patients. And before Ja Marr's program, we were hovering right below 60% patient satisfaction, meaning 60% of our patients were happy with our service. After the program, about 4 months in, we achieved a 94%
Wow.
patient satisfaction
Huge
score.
leap.
It's a major leap, and the major difference was the shift in the mindset and the culture of the organization and our focus. And that was a major difference between before the program and after the program.
Why would you recommend using the Kaizen Way to other doctors, to other organizations, businesses, agencies looking to improve?
Well, I think it works. It's simple and it works. It's one of those things that is not complicated. And I think there's a lot of talented people out there, a lot of hardworking people out there, and they need the guidance to make themselves better and the organizations better. And it sustains itself. It's not just for 1 month. It's something that will last a long time, and that's the difference with Jamar. And that's why I recommend that everybody do this, because every once in a while you have to reflect back and really figure out, are we moving in the right direction? Are my energies being spent in the right places? And am I individually doing the best job I possibly can? And that's something that Jamar did as well during the program. That was a subset of the overall goal, is they really walked away with really a sense of purpose and figured out how, myself as a COO, what can I do to fulfill that purpose, and what can I do to improve myself?
Jamar, any final thoughts? Those people watching here today who are considering taking kind of more of an interest now that they've had a chance to kind of hear a discussion today, any kind of final thoughts or views you'd like to express?
First of all, I want to thank Alex for coming today. Obviously, you didn't have to, and I appreciate your thoughts about our working relationship and the benefits of the program, because I think any consultant out there should be put to the test. They should have their clients come in and say what worked, what didn't work, what can be improved, and really provide a real world scenario for people that are considering any program. So I welcome people questioning the program, digging deep into it. Does it really work? Does it really affect change? And hopefully we've demonstrated today that, based on my own career using the Kaizen principles myself for 20 plus years and showing the success, and then looking at the organizations that I've worked with and their success, and then hearing from Alex and what happened with Atlantis Eyecare. And there's other things, because when you have high patient satisfaction and employees that are motivated, guess what? Revenue increases, and Alex probably can't get into all the details, but revenue increases, productivity increases, ideas, innovation, all that comes to the forefront because everyone is going in the same direction. And that's really what this program is all about. So once again, Alex, thank you very much, and I appreciate everyone watching today.
And Alex, I want to thank you too. Thank you so much for being in studio with us today. And Ja Marr Brown, as always, my friend, it's good to see you, President of the Kaizen Way. And as we've just learned from Jamar and one of his clients, Alex Lopez of Atlantis Eyecare, the consulting philosophies of the Kaizen Way go well beyond theory to real proven results in the areas of sales, leadership, communication, and helping organizations create a culture of excellence. If you'd like to learn more about the services Ja Marr Brown provides through the Kaizen Way, you can call 949-371-9077 or visit thekaizenway.com. We invite you to check out other important stories and segments of interest by visiting our website at SoCalCEO.com. Until next time, I'm Jeff Allen. Thanks again for watching Southern California CEO.